Welcome to Raaonline. Today's topic will be about the diabetes mellitus in pregnancy regarding the MCQs regarding the gestational diabetes mellitus and overt diabetes mellitus. So moving on to the first question. So what is class A2 in diabetes classification? So usually the diabetes mellitus in pregnancy can be classified as you have this type 1 and type 2 diabetes mellitus. This will be one group. So they are called as the overt diabetes mellitus, which is the lady is having diabetes mellitus before her pregnancy itself. So it can be a type 1 diabetes mellitus, which means that there is an absolute insulin deficiency because of the dysfunction of the beta cells of the pancreas. This type 2 is actually opposite. It is because of the increase in the insulin resistance. So that is number 1, and number 2 will be the GDM. So GDM is gestational diabetes mellitus in pregnancy, and you have A1 and A2. A1 means that the patient is having gestational diabetes mellitus and that is well controlled. So this is well controlled on diet. So you need not put her on insulin or you need not put her on OHA. It is well controlled on diet. But when we talk about A2, A2 is something she needs intervention. So you have put her on diet, but it's not, it is still in the higher side, and then we will start her on medication. So it can be OHAs or it can also be insulin. So which means A1 is GDM, which we call as GDM on diet. So A1 will be GDM on diet and A2 will be GDM on OHA, or she can be on OHA or she can be on insulin. Okay. So now moving on to the question. So what is class A2 in diabetes classification? This overt diabetes, they will come under type 1, which is entirely different. GDM on diet is class A1. GDM on medication is class A2. So class A2 is GDM on medication. So which of the following statement regarding type 1 diabetes mellitus is false? So type 1 diabetes mellitus is usually occurs at young age, which is correct. The next thing is it is due to pancreatic beta cell destruction leading to absolute insulin deficiency. So this is the definition. Type 1 is mainly because what happens is that because of genetic conditions, there occurs dysfunction of the pancreatic beta cells, which leads to absolute insulin deficiency. These patients will have absolute insulin deficiency and you have to put them on insulin so that the blood glucose level doesn't spikes up. And this type 1 diabetes mellitus, it is more prone to hypoglycemia is also correct. It is less prone to decay, which is wrong. More than type 2, type 1 is more prone to decay. So automatically this one will be the correct answer. So it is more prone to decay. So this statement is false.